All right, welcome back to Dr. Moses' channel. And on today's episode, we want to talk about medications that are causing you to have constipation. Now, most of you, maybe you're eating well, you're exercising, and you're still having constipation. So it's not necessarily the food you are eating, but there is some of the medication you could be taking can cause constipation. And today, I want to give you a list of those medications. And next week, we'll talk about some of the home remedies that we can use that has been proven to help alleviate severe constipation. So let's dive into it. The first group of medication is blood pressure medications. In this group, we have the calcium channel blockers, that is verapamil, diltiazem especially. These will relax the smooth muscles of your gut and therefore give you constipation. The other group in the same blood pressure medication is beta blockers. And within the beta blockers, we have atenolol, metoprolol, propranolol. And what these do is that they affect the nervous system, therefore slow down the movement of food through the gut and therefore cause constipation. There are other beta blockers that do not cause constipation, like Coreg or carvedilol. That will be a good one to take. So if you have to be on a beta blocker, please talk to your doctor to change them to help with the constipation. Now, the second group of medication is pain medicines, especially narcotic pain medication. All of us know that when you take narcotic pain medication, it slows down your gut, and that's why many people who are suffering from chronic pain, they have constipation, and this bothers them a lot. And so the other medication group that can also cause constipation within the pain medicine is NSAIDs. Yes, if you take chronically naproxen, ibuprofen, Advil, these medications disrupt the natural production of prostaglandins, which help with smooth muscle contraction. So when you take them, it blocks that, and therefore you can have constipation. And the third group of medication are antidepressants, like the Prozac, the Zoloft, the Celexa, amitriptyline, nortriptyline. All these group of antidepressant will slow down the movement of stuff through the guts, and that's why you have constipation. The fourth group of medication that can also cause constipation is the iron supplement. Most people have chronic anemia or iron deficiency anemia, and they have to be on iron supplement. But unfortunately, most of the ones that are prescribed to you, the iron sulfate, the ferrous gluconate, those can give you constipation. So the question is, what should you do if you have iron deficiency and you have to be on iron? There are certain irons that you can take that has less constipation effect, and these are the heme iron supplement, and also have the iron-rich aspergillus oryzae. And also we have the iron glycinate, the iron glycinate. These ones has less constipation effect. So if you have to be on iron, talk to your doctor and see if they can switch that for you. The fifth group of medication that can also give you constipation are antihistamines, especially the Benadryl, dosalamine, chlorpheramine. These will cause constipation. So if you have allergies and you have to be on antihistamines, you want to take the ones like loratadine or Claritin, Allegra. These ones do not cause constipation. So if you have to be on antihistamine, this is what you should be taking instead of the Benadryl and then the other ones that I just mentioned earlier. The sixth group of medication that can cause constipation is antacids. Antacid, like Tums, people take over the counter, Maalox, because of heartburn. But if you're on those medications chronically, you will get constipation. So you should avoid them if you can. The last but not the least, the seventh group of medication are psychotic. These are medications that are used in treating conditions like schizophrenia or people who has bipolar disorder. They take these medications, and these can cause also constipation. Zyprexa is commonly given to our elderly folks who have dementia, or clozapine can also given, and these medications will also lead to constipation. So if you're on this medication, I want to discuss with your doctor to see there's an alternative to it, because these could be the reason for your constipation. Now, if you've been blessed by this information, if you have some good information on this episode, I want you to subscribe to my channel and also give me a like, and also leaving some comment or share this information with friends who are suffering and battling constipation. This might be a lifesaver for somebody. So, but until then, I say you stay well.